Hi everyone, Dr. Chhavi Mehra here. Welcome to our channel, and today we will discuss the effects of diabetes and its impact on our mental health. Diabetes is well known as a metabolic disorder but has psychological consequences. Besides having physical comorbidities, it has a number of mental comorbidities. People with type 1 diabetes are 3 times more susceptible to depression than people who don't have diabetes, and people with type 2 diabetes are twice more susceptible to depression. A cross-national study revealed that more than 18% people with diabetes have some kind of anxiety, 10.6% have clinical depression, and 18% have moderate to severe depression. The psychological consequences of diabetes are mainly divided into 2 types. One is called the diabetes distress, and the second is depression. Diabetes distress, if I want to separate it from depression, is basically more of anxiety, fear, symptoms as a result of a few effects that diabetes has on patients, while depression is a biochemical change that can exist because of the disease. Diabetes distress comes from various reasons. Powerlessness distress is unsuccessfully trying to control the different difficult aspects of the disease. Social perception distress, where there is a fear of being discriminated by people, by employers in social setting. Physician distress, lack of confidence in the medications and treatment provided by a doctor. Friends and family distress, fear of being considered sick by the family. Hypoglycemic distress, in a fear of getting hypoglycemia while they're sleeping or driving, having consequence of hypoglycemia, and that is why worried to take medications. Eating distress, feeling stress because they have not been able to eat the right things, keep the discipline of exercise, all adds to the stress that diabetics have. All these distresses lead to a state of generalized anxiety, and that precipitates into behavioral changes, like patient will be angry, they might have a burnout, they will have guilt feelings, they will have fear, frustration, and constant worry. High levels of diabetes distress can lead to a higher A1C, a high BMI, poor social support, negative health beliefs, poor self-care behavior, and poor quality of life. Management of diabetes distress is mainly by psychological education, supportive therapy, counseling, mainly concentrating on behavior management. Diabetes patients develop depression due to increased burden of disease management and the biochemical changes accompanying diabetes. Usually this can be managed through non-medical approach by counseling. One of the methods is called ACT, which is the acceptance and commitment therapy, in which there is acceptance of distressing thoughts, feelings, and emotions. CBT, or cognitive behavioral therapy, is the other mode of management of depression and diabetes. If these do not work, then a psychiatrist or a management of depression through medication is used. At the end, I want to say that diabetes is a difficult life condition, and people suffering from diabetes tend to face many challenges at the physical, psychological, social, occupational, and interpersonal level. There is light at the end of the tunnel. The healthcare provider that you see, it could be a doctor or a health coach. Be open about these negative feelings, accept the distressing thoughts you face, the fear and guilt, and that could lead into a much better outcome or management of your distress or depression.